Hi, I am Ishita, a dental student, and I made this video because there's something really important I want to share with you, especially if you are in your first year BDS and first year is about to start. See, because if you don't understand this now, it can seriously affect your mind later. I don't want you to get distracted. I don't want you to lose focus just because of what people say or how society looks at you. So, the truth is, this profession already demands so much from you: sleepless nights, lectures, practicals, pressure of exams. But what actually hurts more than the syllabus is the mental load you carry because of people's words, the taunts, the comparison, the silent pity, even social media comments. They creep into your head. They sit there slowly. They break you down. So, I especially made this video because I don't want you guys to be in that dark and enjoy your life as well as study. And you know the most painful part? Sometimes it's not even others who degrade this profession. It's us. It's we ourselves who start joking about it, who start saying, "Ha yaar, BDS to side degree hai." And without realizing it, we kill our own confidence from within. That's why I made this video. Not just to motivate you, but to guide you, to warn you about this trap that can destroy your mental health if you let it. So, see, if like I tell you about my own life, when I was a child, I always used to say, I want to be a doctor. I want to treat patients. I want to cure them. I want to relieve their pain. I never said I want to do MBBS or I want to be a BDS. I just said I want to be a doctor. But then, as you grow up, society starts dividing. Suddenly, it's not about being a doctor anymore. It's about which degree you hold, and people begin to tell you, oh, MBBS is the real doctor degree, and BDS is like secondary. If you don't get MBBS, you can take BDS. But think deeply. Is it what you told yourself when you were 10 years old? Did you dream of degree name or did you dream of curing people? So that's why I say it's not about how you came here. It's about what you do when you are here. The patient lying on a chair in pain doesn't care whether like you are MBBS or BDS. They just care if you can help them, if you can cure them, if you can relieve their pain. And you know, the sad reality is that sometimes this stigma hits you silently. Maybe at a family gathering when someone asks you, Beta, what are you doing? And the moment you say BDS, their tone changes like they are giving you silent sympathy. Like, oh, you couldn't make it to MBBS, it's okay. Or maybe you see a reel on social media where some says dentists are not real doctors and people laugh in the comments and you start to think, are they right? Am I really less? And these thoughts are dangerous because they don't just affect your studies, they affect your mental health. They drain your confidence before you have like even had the chance to prove yourself. And listen to this carefully. Many BD students don't get degraded by others. They degrade themselves. When you don't respect your own field, how can you expect society to respect it? Like, respect begins from within. Let me tell you a story that completely changed the way I looked at this profession. So, there's a renowned oral and maxillofacial surgeon in India. Today, he is celebrated, respected. People call him a lifesaver. But he started exactly like you as a BD student. He heard the same taunts, faced the same doubts, probably listened to the same line: dentists are not real doctors. So, this renowned surgeon has treated so many patients. So, let me tell you a story of a man who was in his 50s, walked into his hospital. So, his face was half destroyed by oral cancer. His speech was unclear, his confidence broken. So, he hadn't looked into a mirror for months. He didn't go to family events anymore. His own children avoided sitting with him because they couldn't bear to see him in pain. And then this surgeon, once just another BDS student, took that patient into the OT. So there was a marathon surgery, hours and hours of effort, tumor removal, jaw reconstruction, then tissue grafting, follow-up care. Slowly that patient could eat again. Slowly he could talk again. And then one day, he stood in front of the mirror and broke down crying. Not because of the pain, but because he could finally smile at his family again. Now tell me, in that moment, did anyone care about degree? Did the patient ask, Doctor, आप MBBS हो या BDS? No. For his family, he was simply the doctor who gave their father a second life. That story taught me something painful. Society will always find ways to compare. But the patient you treat, they don't see MBBS or BDS. They just see hope, healing, and relief. And that is worth more than any label. So listen carefully. Even if BDS was not your first choice, now that you are here, you have to embrace it. Don't waste time comparing. Don't waste time crying about what you couldn't get. Focus on what you have. This degree can save lives, transform lives, if you respect it. You know, people love comparing MBBS versus BDS, this versus that. But think logically. If you have a heart problem, will you go to a gynecologist? If you need brain surgery, will you go to a cardiologist? No. Every branch of medicine has its own specialists, so its own importance, its own role in saving lives. Dentistry is not different. We are not here to compete with MBBS doctors. We are here to complete the bigger picture of healthcare. Just like every specialist in medicine, we too have a responsibility to diagnose, to heal, to restore, to bring back the confidence in people's lives. So each doctor have different paths, different journeys, different purposes, but in the end, all of them work together to make a difference in patient's life. That's exactly what BDS is. A different role, but equally vital. And I would not say that even if BDS was your first choice. Like, see, by becoming a doctor, you didn't have to choose MBBS or BDS. You wanted to be a doctor. You wanted to become doctor. You wanted to help others. So it's now your path, your responsibility, your like opportunity. Embrace it fully, respect it deeply, and carry yourself with pride. Because the moment you honor your own profession, the world will have no choice but to respect it too. And one day, when a patient looks at you with gratitude and says, Thank you, doctor, you'll realize all the doubts, all the comparison, all the judgments, they were never about you. They were just distractions. You are a doctor, you are powerful, and your journey is just beginning. Stay confident, embrace your path, keep making a difference. Don't let distractions affect you. It's your journey, it's your life. You gotta make it or you gotta ruin it. So, choice is up to you. Please, if you have got this opportunity to be a person who can heal, please, guys, don't let that go in vain. Help people, make difference in their lives, save them. And as I say in my all videos, don't forget to brush your teeth and stay blessed. I'll see you in my next video. Bye bye.